the squamous suture anterior to attached to sphenoid, squamous part and mastoid part. How many fontanelles does we have? Four fontanelles. Anterior fontanelle, posterior fontanelle, yeah, posterolateral. For posterolateral is also named mastoidal, and yeah, anterolateral, okay, or is named sphenoidal. What is the name of this H?
Pterion.
Yes, pterion. Okay. The parietal bone. Parietal bone in here. It is occipital, it is frontal, and it is parietal bone. Anterior to the long-bridge suture, we have a foramen. Parietal foramen, and also here we can see in the central part parietal tubers, The highest area in the superior view of the skull, which is locating in the sagittal suture, is named vertex. Yes, vertex. Another bone is here. In the internal view of the parietal bone, you can see the screws. The screws are the site for meningeal vessels. I said that anterior branch of the middle meningeal artery passes deep to pterion. Yes. So you find pterion in this area here. Here is the site of pterion. Yes. If you see in this area, you can see this groove. So this groove is groove for anterior branch of middle meningeal artery. Also, you can see some small fova which are near to sagittal groove. They are named granular fova. Okay, granular fova. Another bone, occipital bone. Here is foramen magnum. Foramen magnum divided occipital bone in 4 parts. Here is a squamous part. They are lateral parts, and here basilar parts. The squamous part has 4 borders, 2 anterior borders, 2 superior border and 2 inferior border. Superior border attached to parietal. See here. Superior borders attached to parietal. Inferior border attached to mastoid part of temporal bone and made a suture. What is the name of this suture? Occipital. Mastoid suture. Occipital. Mastoid suture. Okay. A squamous part, it has 2 surfaces, external and internal surface. In the external surface, in the central part, you can see external occipital protuberance. From external occipital protuberance, superiorly, you can see a line which is not so obvious in this skull. Okay? Highest nuchal line, or also is named supreme nuchal line. This line is like a crest, superior nuchal line. The superior nuchal line is the boundary of the skull and the neck. And I said that it is the site for attachment of this muscle. What is this muscle?
Trapezius.
Yes, trapezius attached to this area. Inferiorly, you can see external occipital crest, which begin from the external occipital protuberance, travel inferiorly to arrive to posterior border of foramen magnum. And from external occipital crest, you can see two lines. Inferior nuchal line which travel to the lateral part. In the internal surface of occipital bone, you can see from the central part, internal occipital protuberance. From internal occipital protuberance, you can see this crest, internal occipital crest. They are just like the external surface. Okay. From internal occipital protuberance, you can see two grooves which travel laterally. They are named transverse grooves. They are the site for transverse sagittal sinus. Yes. And also, this groove made four fossa, two inferior fossa and two superior fossa. Inferior fossa are the site for
cerebellum.
Yes, cerebellar hemisphere. Cerebellum has two hemispheres, and superior occipital hemisphere. Okay, occipital lobe of the brain. Here, basilar part. Basilar part has four border, two surfaces. Anterior border, excuse me, posterior border made the anterior border of foramen magnum. Anterior border attached to
sphenoid.
See here,
Body of sphenoid.
yes, attached to the posterior part of posterior surface of body of the sphenoid. Lateral border attached to, see here,
greater wing.
see here,
Temporal.
it is anterior border and it is lateral border. This is petrous part of temporal bone. So, the lateral border attached to the petrous part of temporal bone, okay? And the structure in this area. In the inferior surface of basilar part, you can see a tubercle. Pharyngeal tubercle. The pharyngeal wrapper attached to the pharyngeal tubercle. Superiorly, in the superior surface, you can see a smooth area. It is the site for
Brainstem.
brainstem. Yes, brainstem. The lateral part. We have two lateral parts. This lateral part has inferior surface and superior surface. In the inferior surface of lateral part, you can see
Condyle.
occipital condyle. Posterior to the occipital condyle, you can see
Canal.
this fossa, condylar fossa, condylar fossa, and sometimes in the condylar fossa maybe we have condylar
Canal.
canals. Yes, I say that every small canal in the skull bones is the site for traveling emissary vein, emissary veins. Lateral to the occipital condyle, you can see the bony elongation of the skull which travel laterally. This is named jugular process. Yes, jugular process. And anterior border of jugular process, we have a notch. See here, it is anterior or posterior border?
Anterior.
Anterior. It is basilar part, it is anterior border. You can see this notch, yes? This notch is named
Jugular notch.
jugular notch. Jugular notch attached to jugular fossa of petrous part to make
Jugular foramen.
jugular foramen. Yes, see here. See here. Occipital condyle. Yes. Lateral to occipital condyle, you can see jugular process. Here is anterior. Anterior border of jugular process, we have a notch which is named jugular notch. I said that jugular notch attached to this fossa. This fossa is
Jugular fossa.
jugular fossa of petrous part. It is petrous part and made this foramen. Made jugular foramen. Okay? See here. What is this canal?
Carotid.
hypoglossal canal.
Hypoglossal.
Yes. Anterior and lateral to this to the condyle, you can see the hypoglossal canal for traveling the hypoglossal nerve. The hypoglossal canal at the superior view covers by this bony eminence. Here is inferior view, inferior surface. Here is superior surface. At the superior surface, the hypoglossal canal, see here, okay, covered by a bony eminence. This bony eminence is named jugular tubercle. Jugular tubercle. Okay. It was occipital bone. Another bone